how about Dr. Lutfan, the regulations, yeah? Confidentiality between patient and doctor. That's a very good question. Yeah.
Well, I think the confidentiality in this case is top of priority.
Top priority.
It is what we actually also discussed in the very beginning when we involved in this project. So we asked that we should always put the issue of confidentiality as a priority. It is why then, although we involve many stakeholders and we involve actually very intensive in the development program, but we could not get access to the medical data of each individual which is involved in these applications. And of course that this is a very important issue that we should always put on the top level. And regarding the regulations, we probably basically still lack of the regulations that, we know that the medical data is confidential, but in terms of the applications, then probably we still waiting for the, we call it in Indonesia, petunjuk pelaksanaan, which is into more detail. It's not just in general regulations, but of course into very practical level.
Yeah.
Thank you.
So for the ethics is there, and the profession, the doctor profession, have observed the ethics, but the regulation itself is not there yet. But if it's a PEPE, that means it's a Ministry of Health executive branch regulation. It doesn't go through Parliament. Yeah.
If I may add something.
Or maybe please, Pasif, yeah, if you want to add.
I think to answer the questions about the regulation, we do have several regulations that govern personal data protection. For example, Permenkes 269, which is govern about medical records, or PP number 10. So it is also govern about the confidentiality. Number 44, number 36 with 2008, 2009 covers about hospital and healthcare. Which also govern, for example, whatever patient data being collected must be assured of its confidentiality, and also about the transferring, the processing, and also the storage of data also being governed into that. But you're right, if we talk about cloud computing, for example, because more and more data is now being stored in cloud, there is no specific regulation concerning that area yet, although there is a regulation that any database concerning Indonesian citizen must be held in database within Indonesian territory. So it cannot be stored outside Indonesian territory. And the latest regulation is currently being ratified by the House of Representatives, 2015, which is the personal data protection within the electronic system, has not passed yet. So it's been discussed within the House of Representatives. Yeah.
So yeah, please. So the regulation is actually the architect regulation is there, but it's the cloud computing that has not. There's not yet a regular. But Dr. Andre would like that. Yeah.
Yeah, this is very interesting since we developed this kind of technology. We believe that ethics and regulation will catching up because our idea is always in front. But then, if we look at the experience of our partners from Jakarta, most of them are the head of the district hospital, the D-type hospital. And they have a special program called Ketuk Pintu Layani Dengan Hati, knock the door and serve the patient with your heart. And then they collect the information one by one and from door to door. And they have the information about any kind of diseases of the people. And then the questions, what about the security of this information? After they collect the information, and then somebody is taking that information out, and they already know that, oh, this family inside this house, they have a lot of health problem, and it becomes a social issue. And I think with this kind of technology, we can support this. So after they enter the information inside the application, and then the data is transferred. It's not recorded manually, which is really dangerous. So This is one example. The program or the good idea is always in front, and the regulation and things like that is still far behind.
Thank you. So, Ibu Lina, you've triggered a round of conversation itself. There's very good questions yet. So, now to Bapak, silakan. Name and background and your question and comments.
Yeah, I'm Agus. I'm coming from Nielsen, Indonesia. Basically, we are talking on the digital and health. Then I have approach on there is a macro and also there is a micro. On the macro side, actually, talking about public health in Indonesia, so far what I know is there is no integrated data among the population, talking about health mapping in Indonesia. Then actually there is an opportunity also to have what we call is integration of the data. If we can leverage the integration of the data in puskesmas, in public care unit and hospital, and then also for the private clinics. If we can merge into one data center, I don't know whether we can put in the public health department or I don't know, in BPS or statistical bureau or something like that. But this is something that very useful for the industry. So this is something that become a homework for us in the government and the policymaker. The second one is on the micro side. On the micro side, then the businessmen need this data to develop and to project up to which level that actually we can apply for Indonesia, and up to which level the potential of the market in Indonesia. Then has to be synergized between the macro and micro. And this is something that probably digital can help. How to synergize between businessmen and also government into the synergy of the strategic approach. This is number one. Suppose there is already a synergy between government and also the public health industry, then up to which level the roadmap is? Up to when that actually we can synergize about it, and how about the map? And of course, the synergy has to be coming from the government, businessmen, and also the expert or coming from the university. And then the final goal is big effective and efficiency in a healthcare system in Indonesia. Both sides can create the money, but also government can also see up to which level the public health level in Indonesia. This is something that I'm concerned, basically how to apply the digital to support the public health in Indonesia. Thanks.
Thank you, Pak Agus. So from a policy maker perspective, now because of lack of time, I'm going to go to the, we'll do a series of comments and questions. We have Ibu in the middle here. Yeah, Bu, yeah, silakan. Yeah, and then the panel can comment and also conclude the session today.
Thank you, Mr. George. My name is Devianti. I'm from Deloitte, Indonesia. Well, I found out that your application is very interesting for me. I have 3 questions. The first is, have you ever tried to collaborate with government related to big data analytics? Okay, as of now, we know that we still have data protection law, which is included medical data confidentiality and so on. Have you ever talked to government related to this application? Have you ever tried to related to BPJS, UHC? Do you have a future plan to collaborate with government related to implementation of BPJS? Second question is, who are your targets? Is it urban people or rural people? If it's rural people, we know that some of them are not well educated. What's your future plan to reach and cover them by your application? And then third question is, I'm just curious, what's the differentiation between your Nusa Health application with S-Health from Samsung and Health from Apple? Okay, that's from me. Thank you.
Thank you very much. And then the last question, Bapak, or comment? Bapak, yeah, silakan.
Actually, my name is Adrian. I'm from FMCG, but part of that in the pharmaceutical also. The Pa Andreas is right in the certain level that is coming from out the business, but also we need to know what is the, if the MD said that we already have the 100 application download now, and in until how many users that number one that you can say this is fit for the business, okay, let's say, and or this is fit for to get the testimonial from the people, like because like this lady said, if the from Apple or Samsung, so this application, especially for Indonesia, we know the youngsters people now population is high, but we know the oldest people also getting higher now. So sometime in the situation in Jakarta is density of the traffic. We are worried to leave our parents at home alone without no connection. So if we can utilize this application, it's very big, it's very good for us. But again, until which level we, I'll say as a business perspective, can getting along with your development. In which area you will be focused by demography. Let's say the first time we will attack for Jakarta. The second is Surabaya. The third is Sumatra. So we can get along also to do the campaign at the previously the campaign of the health or medical. It's now need to be disrupted, not just put the poster and everything in the Puskesmas and everything, but we need to go through. So that is my question. Thank you.
Thank you, Pa. Thank you. So the last two questions was on the product itself. So I'll give Pa Cliff and then maybe Ibu Shing comments, and then the next question or by Bapak Agus is the policy side. So I'll have Dr. Andre and either Professor Herini or Dr. Lutfan share that, and then I'd like Mr. Steve to provide the closing statements or remarks on what you see as the challenge in the future of this particular conversation. So please, yeah.
What's the question?
The question is, first of all, Nusa Health itself.
Yes.
How do you see the demographics? Yeah, is it rural? Is it urban? Secondly, on Ibu Desianti's question was, is Nusa Health in terms of the big data analytics and government? How do you see the interlinks here? Go ahead.
So we're just because of access and the ability to control and reach the early users, we'll probably start in Jogja, and they'll probably roll out Jakarta as well. But absolutely, one of the potentials of this solution is to give people access to healthcare, whereas they normally would not have access to healthcare. So, or it's inconvenient or what have you. So the ability to, with your phone or a wearable, be able to capture your vitals and then share those vitals with a clinician or a doctor through a telehealth session, through a virtual consult, I think would allow us to reach a lot of folks that normally wouldn't have access or easy access to healthcare. So at the end of the day, we'd love to have everybody on Nusa Health, but where we start is where we have access. And then the second question was
between Samsung and Apple. What is the difference between Nusa Health and Samsung?
So Samsung Health, the health app on iOS, they're aggregators, and they aggregate all of your activity data. So if you've got a Fitbit, you can import that data into a Samsung or an Apple app. If you're walking, you can actually use the phone itself to measure the number of steps that you've walked. If you've got a diet app, you can. There isn't an app where you can take a picture of your meal and have it interpret what you're about to eat, but you can punch in the items from your meal, and then that tracks your diet, and it tells you kind of where you're deficient and all that. So it's an aggregator, And the the data that you collect is made available on an anonymized basis for research. I think how we're different is we've got there is no a collection of a bunch of third-party applications. We're very specific and laser focused in terms of what we want to collect. What we want to collect allows us to segment the population, and it's in that segmentation that you're going to discover things you may not have thought about in terms of what the trending disease areas are. You're not going to get that out of your step counts. So, and once we identify what those trending disease areas are, or once the policymakers have come back and said, hey, we want to really get a handle on diabetes, right? So that's the focus. You can create behavior change programs that manage patients with those chronic diseases. Again, Apple and Samsung, those two apps don't do that. We want to give patients access to their clinical data, to their blood data, to their lab data. Apple and Samsung don't do that. And at the end of the day, this is really a synchronization, okay? It's a movement, and it's a synchronization of providers, payers, and populations. Apple and Samsung don't do that.